Hello, everyone. Welcome to another Fresh Dental Shadowing session. Today, we're very excited to have with us Dr. Jessica Kaplan. She'll be sharing her experience through pediatric dentistry. So, Dr. Kaplan, whenever you're ready, you may begin.
Okay, so hi guys. I'm Jessica. Thank you for the introduction. I just want to confirm you guys are mostly college students, right? Yes. Okay. All right. Always helpful when I know who I'm talking to. So I am a pediatric dentist, and what I'm going to talk about tonight is kind of how I got to where I am today. So, background, school, and all that, starting in college and then dental school and residency. I'm going to talk about how I picked the dental school I went to and the residency program that I went to, why I picked pediatric dentistry and why I love it so much, and different jobs that I've had and working environments that I've been in, and then what it's like to be a pediatric dentist, like a day in my life in my office. So before I went to dental school, I went to Emory in Atlanta. That was a pretty easy decision for me. I applied early decision. I knew I wanted to go there. I am originally from New Jersey, and I just kind of wanted to go somewhere different, get some warmth, some sunshine, and I fell in love with Emory. And I did not know what I wanted to do when I was a freshman. I definitely did not know that I wanted to be a dentist. But I always kind of did well in science and math classes. So I figured I would just kind of follow that, maybe do like a pre-med track and just see where it took me. And I ended up making a friend who was in this major called neuroscience and behavior biology, and her classes sounded really cool. So I took them too. And then I loved that major. It was really cool. I got to take a lot of different science classes, like in different departments. So like in psych and biochem, all different departments. Instead of just doing like a bio major, chem major, I just wanted to learn more and see what else was out there. And in that process, I somehow, I don't know how, because neuroscience has nothing to do really with dentistry, but somehow figured out I wanted to be a dentist when I was a sophomore. And so once I kind of was like, okay, this is what I need to do, I then tried to put together like, what to expect throughout the next couple of years in terms of lab sciences and prereqs and all that. And while I was doing that, I realized I couldn't study abroad over a fall or spring semester, which I really wanted to do. So I did 2 summers abroad, which I thought was great and something that's just helped me shape who I am today and great experiences. So I'd recommend that to anybody. Like, don't feel like you can't study abroad if you're, want to go into dental school straight out of college. You definitely can take advantage of your summers. And then other things that I did while I was in college was I shadowed a lot in a dental office. So the dentist that I saw growing up, she's a general dentist in my hometown, and I spent over 100 hours over a winter break with her. So like every day in her office, just seeing what that was about, which was really important. There were some dental schools that I applied to that required that. A lot of them did not, but it was good to still have on my resume. And then eventually took the DAT and did my dental school applications junior year, so that way I could go straight into dental school after college, and kind of somehow pulled it all together, and it worked out well. Got everything done in time. And something fun that I felt like was a great experience while I was in college was I did the Global Dental Brigades. So I traveled to Honduras one summer, this summer going into senior year. It was like maybe like a 2-week trip. And I don't know if any of you guys are familiar or not with the Global Dental Brigades, if it's still happening or not. I don't know what trips are happening with COVID and all that, but it's basically like a local partnership where there's people on the ground there who help facilitate a medical and dental mission, and they help staff it locally, and then they bring in volunteers. So like I was still in college, I wasn't doing dentistry, but like I was helping with like paperwork and check-in and like getting instruments organized and sterilized and moving patients back and forth. So just like very limited exposure, but just also a fun trip and do something different. So then the summer, what was it? Right after the global dental brigades, I also interned at NYU. So this was like a huge experience that really basically laid the foundation for everything that I've done since. So at that point, I had applied to dental schools. Everything was done and sent in. My dad was done. And I basically had nothing to do over the summer. So I figured, let me see if I could find a dental school where I could just like show up to and volunteer my time in a way. I don't know who would need me where, but at this point, I loved doing volunteer work and outreaches. And I figured, let me just go on Google and type in NYU Dental School and outreach department. And I did. I also typed in Columbia because I knew I wanted to live in New York City. So I figured, let me just see what else is out there. And I called them both. Columbia, just for whatever reason, I don't know if I could get through to anybody on the phone, or their outreach department just, I don't know, didn't answer that day, whatever it was. But someone at NYU answered, and they were like, "Hi, I'm so-and-so, whatever." And I was like, "Hi, I'm Jessica. I want to be a dentist. I want to go to dental school. I want to go to NYU, and I'm happy to work for free and do whatever you need." And they were like, "Oh, that's really interesting. Why don't you come up, meet us, and we'll see if maybe you can spend some time with us." And so we did. Had like an interview with them, and I basically worked as an assistant in their department, kind of doing anything and everything from like helping with paperwork for organizing their outreach trips, helping organize and pack their supplies for their outreach trips, work with their partners, help with research because they do a lot of research and data collection, anything really, even like photocopying papers, like no job is too small. So that was really cool because from there I met a lot of people at NYU, and it kind of made me decide that I really wanted to go to NYU Dental School. Another good thing though that I did that summer was I did a program called Gateway to Dentistry at UMDNJ, and I forget how long that program was, maybe 2 weeks or something, but it was really cool in the sense that I had a lot of exposure to what life is like in dental school, which I hadn't seen before. We got to play around in the sim lab. We got to, we were just like in the dental school day in and day out. And so we interacted with the dental students and had like little sim labs and clinics, and like, it was like mini dental school for 2 weeks. So that just like also, made me feel comfortable there and feel like I was on the right path, which was good. And so then I went back to college in the fall, went on a bunch of interviews to different dental schools. And what I was looking for in dental schools was just a lot of clinical experience, lots of rotations in specialty clinics, because I knew I wanted to probably go into pediatrics, even though everybody tells you you're not supposed to know what you want and you're not supposed to admit it. I was pretty upfront about it, and I knew, and that's what I was really looking for in a dental school, somewhere that would like let me admit it and let me spend a lot of time in their post-grad clinic. And so I felt like just, NYU was a good fit for me in that sense. And so then I graduated from Emory. I had committed to NYU, but there were some other dental schools that I liked and felt like probably would have been good fits too, which if you have questions about, I can talk more about also if I can remember that far back at the end. So then once I got into NYU, they offered this, they call it a D0, so you're not really a first-year dental school student yet, which is a D1. So they call it the D0 research program. And because I had spent the last summer working in the outreach department, they let me go back into that outreach department to do a research program with them. And what was great about that program was I was able to actually get research credit from doing that, which is always good to have on your application for residency programs. So even though that was like so far in advance, I didn't even realize that was going to be something that I needed. It was great that I kind of ticked that box and didn't even plan to. But what I loved about it was I got to spend more time in the outreach department, and they took me on my first outreach trip with them, which was awesome. And instead of kind of doing like a lot of random things, which I still did a couple random things like photocopy papers and things like that, but I actually worked on a research project too, which was cool. So with NYU, I was able to travel a lot, which was amazing on these outreach programs. So the first one they took me on was to Grenada. We did some local ones in Poughkeepsie, and then I went to Nicaragua as a third-year dental student, and I went to Nepal as a fourth-year dental student. And then I went back to Poughkeepsie as a resident too when I was in Peds. These were all great programs. The first two times that I went on, so I was able to do a little bit more. In Nicaragua, I was third-year student, like I said, so in the clinic. And then in Nepal, what was great was I knew I was going to go into Peds, and so they let me basically spend the whole week in the pediatric part of the clinic. And yeah, it was really helpful. I got to see a lot and treat a lot of patients, and make friends with some of the residents and some of the faculty, which was awesome. And then in Poughkeepsie, when you go as a resident, you're like kind of faculty, so you're like teaching the dental students and on the other end of it, which is cool. So while I was in dental school, one of the things that I think was so important and that I've taken away still to this day is that it's such a big school at NYU, and you can make friends with anybody from anywhere, from like people that are in your class sitting next to you in lab to like the people that work there, the faculty. And these people I'm still in touch with today and like have helped me get the jobs that I have and give me advice all the time on things that I call them about, like, should I buy this dental office right now, or should I go move to this place and practice dentistry somewhere else? Like there's, I made a lot of friends and a lot of mentors, which was amazing. The amount of clubs and like student council organizations is infinite at NYU. So there's a lot of different, like whatever you want to get involved in, there's something for you, which was great. Like I said, it was really important to me that I was going to be able to shadow in whatever post-grad clinic I wanted to. And so I wanted to spend a lot of time in the Peds clinic. And I did that. I shadowed a lot of after hours, like in addition to my rotations. And then they also had an honors program in pediatrics. So I applied to the honors program, which was great because it was basically kind of like the extra hour shadowing, but instead of shadowing, I was treating patients. So, just got more pedo experience, made friends with more faculty. And because of all that extra time I spent there, I really wanted to stay there for Peds. So I went on a bunch of interviews, but kind of always knew I was just going to stay at NYU. So the things that were important to me in a PG program were, NYU is a hospital and dental school program. So it's a combination, whereas a lot of programs are just hospital based. So the hospital / university program is a little different because you get a lot of didactics and a lot of board prep, which I thought was important. I wanted something like a little more laid back and like not as intense as like a really busy city hospital. So while I was in residency, I had a great time. It was a lot more fun than dental school. Dental school was very stressful. you're constantly being like watched, and you have to check in with faculty when you're in the clinic. There's so many tests and quizzes and labs and requirements, and dental school is very stressful. Residency was a lot of fun. Not as many requirements at all. Basically, the only things you have to do are like collect a certain amount of cases, which you have to do in dental school too, but it just naturally falls into your lap in residency. And then you present those cases at the end of the year. You have to do a research project, which everybody does. And so even though it's not so much fun or not the easiest thing, everybody's doing it, you all do it together, you kind of just get through it. And they make you take your first part of the board certification while you're in residency. So like I said, I loved it, lots of fun, taught me a lot. I'm still in touch with my mentors and my attendings from dental school and also residency at NYU in the pediatric department. Yeah. So going then out into the real world after graduating and spending the last 6 years at NYU, I was shell-shocked. I thought I was gonna like fling open my front door and just be like, hi, I am a pediatric dentist. Who needs me? And just like a job was gonna like fall in my lap. And that's not at all the case. There are jobs out there, but it definitely just like took more work than I was anticipating, I think. And nobody really prepped me for it. You know, like you go through dental school and like you just learn how to treat patients and how to be a dentist. No one teaches you like how to find a job. So spent a lot of time on like the typical websites like Indeed and Glassdoor and things like that, but then also a lot of time networking with my faculty and their friends and friends of friends, or friends that, you know, residents that had already graduated or who had offices that were looking to fill jobs. So yeah, it took a while. And in New York State, it takes a while to get your dental license if you go straight through from dental school to residency. So it was a bit of a gap between like graduating, residency, and working, probably about like 2 months. So well, it was nice to have the break. You know, it's like you go through 6 years of school, you think you're going to be done and just start working and like make money and move on, but it's definitely not the case. So what I found myself doing, and a lot of my co-residents and even friends that are not specialists doing, is a lot of people take part-time jobs. So multiple jobs, like 2 or 3 jobs, and you work a few days a week here, a few days a week there, maybe once a month somewhere else. So you kind of like piece things together, and then over time, eventually like remove things or add things to like make it all work you want to work. So the way that I did it was I worked in 2 different jobs. So I worked in a Medicaid office 2 to 3 times a week. It was all pediatrics. It was a pediatric office. It was very high volume. And because it's Medicaid, it has a lower reimbursement rate. And for kids, at least, when you're in mostly Medicaid offices, usually it's a very, very high risk. So it's really busy, lots of operative, lots of kids with emergencies, and it's just, yeah, your head like spins a little bit, but not in a bad way. You're just really busy. But it was a great, great experience because I went from seeing like, I don't know, 7 or 8 patients a day in residency in the dental school, and then maybe like 10 or 11 patients a day in the hospital, to then seeing like 30 patients a day in a Medicaid office. So you really learn to be efficient. You learn how a dental office like runs so differently than a residency clinic or a dental school, and that you have all the support staff, you have these assistants and hygienists and front desk, and like everybody's there to support you as the doctor, which is crazy because in dental school you're like, nobody's here to help me, I'm only helping me. So it's nice in that sense. Like you learn, you know, what the real world is like. But the more I spent time there, the more I kind of realized it wasn't really the right fit for me. I like to spend a lot of time with my patients. I like a slower paced environment. So while I was working there, I was also working twice a week in a multi-specialty office, which is it. So I'm there. We have an oral surgeon, two prosthodontists, an endodontist, and an orthodontist. So it's a lot of specialists. It's a PPO, fee for service office, and it's in like a higher socioeconomic status area. So as far as kids go, what I was saying before, like, you know, when you're in lower socioeconomic status or Medicaid practices, it's high risk. And usually when you're in a fee for service, PPO, very often, and depending on the geographic location, it can be a lot lower risk. So a lot of my day is spent doing more prevention and less operative, which I enjoy. So I ended up phasing out of my Medicaid office and phasing more into my multi-specialty office, and I'm there now 4 days a week. And I love it. I think everybody likes different things, and there's different personalities for different reasons, even within specialties of what people like and don't like. Like, I have friends that will only work in a Medicaid office and not work in a fee-for-service office, and vice versa. So, you know, there's so much space in what we do for everybody, which is great. So yeah, I think, you know, you kind of have to spend time working in these different offices to figure out what works and what you like and what you don't like, and then ultimately build up from there. So what I do now, as I was saying, 4 days a week, I actually don't work Saturdays anymore, but I did work Saturdays for a while, which is very common, especially when you're first starting out, but in dentistry in general, usually Saturdays are a busy day. So I do a lot of new patient exams. I spend a lot of time with my patients and recalls going over their history. So, like, you know, have they been to the dentist before? How many times? What have they spoken to their last dentist about? What habits do they have? So, like pacifiers, thumb sucking, nail biting, snoring, grinding, mouth breathing. We talk about home care, obviously, like brushing, flossing, when to start flossing, when to start brushing. We talk a lot about diet and pediatrics. So we talk about carbohydrates and how that influences the pH in the mouth and how that causes a environment for cavities to thrive in. And we talk about what snacks they're eating, how many times a day, and, you know, what that structure should look like for meals and snacks, and what they should be drinking in between meals and snacks. And yeah, it's very, very like detailed, to the point that, you know, I didn't think that I would be talking to patients about those sorts of things when I was in dental school, but we do. We do a lot of anticipatory guidance. So, like, okay, your child is 3, their teeth are going to start falling out at 6, they'll start getting new molars around 6, they'll do this, they'll be able to brush on their own when they turn 7 probably. So like what's down the line. And we talk about like what they're doing and how to make things better at home, so we can work together as a team. I do a lot of sealants, so we protect the newly erupting permanent teeth from getting cavities. We use something called silver diamine fluoride a lot, which is a topical fluoride similar to like what you get painted on at the end of your dentist visit, the fluoride varnish, but it's a very high concentration of fluoride that we use to treat decay. So it's really great for kids because all you have to do is paint it on the tooth. You don't have to numb them, you don't have to drill, you don't have to put the filling in, you don't have to check their bite, like none of that. There's no pain. And even still, sometimes that's hard to do on kids, but it makes things a lot easier when you have other options. So then we obviously also do operative treatment, so like fillings and crowns, things like that. And whenever we're doing operative, there's always lots of behavior management involved. So like tell, show, do, showing them things, before we use them, like, this is the, I call it the motorcycle, like one of the drills, Mr. Thirsty or the water gun, or, making things kid friendly. We use the nitrous oxide, so laughing gas. I call that the ice cream air. And then another option that we have in our office, and some other offices have it, but if not, other hospitals, usually most hospitals have it, is general anesthesia. So sometimes when nitrous oxide isn't enough and the kids have a lot of need, a lot of decay, we do put them to sleep under general anesthesia. So we have an anesthesiologist that we work with that does that, and then we do all their dentistry. We also do early orthodontics and space management. I also have an orthodontist in my office who does a lot of phase 1, so early treatment of malocclusion and, guiding growth and development, which is great to see the befores and afters. The kids do so well with it. And it's really nice as a practice builder, as a pediatric dentist, to have an orthodontist in your office, because you get to see those kids, come in every month next door, like literally in the next operatory, to see the orthodontist all the time. And they come back in, for their checkups and cleanings with you. And so having that like back and forth in terms of treatment planning and care for the patient is really nice. We, as pediatric dentists, we are trained to do sedation, so oral sedation. I don't do it in my office, but a lot of pediatric dentists do. We treat special needs patients too as pediatric dentists. So I have kids that are from like 0 up until in their 20s and 30s that I see who have special needs, because a lot of times they get attached to their pediatric dentist and they don't want to change. So they'll stay with us through adulthood. And then, like I said, we work alongside the orthodontist and then other specialists too, like the oral surgeon and sometimes even the endodontist, which is why I love working in a multi-specialty office. And I do a lot of, well, since COVID, a little less, but I still do some outreach and community partnerships and visiting daycares, things like that, schools, health fairs. Where I work now, it's like very community based, like very neighborhoody. So we get a lot of referrals from the schools in the area, which is great. And I go visit them, and they know us from the office. It's nice. And then, of course, emergencies come in, like abscesses, like infections. But in my office now, not as frequent. We get a lot more of like falls and bumps and broken teeth, things like that, like little ones with emergencies. And so my favorite part about being a pediatric dentist is first visits. This is actually my 1-year-old when she came for her first visit. So you just gotta be quick, get it done, let them scream and cry. When they're screaming and crying, their mouth is open, so you can actually see even better. So that part doesn't bother me, but I love seeing the little ones come in at 1, which is what we recommend as pediatric dentists, because we get to influence everything, their diet, their home care, their habits, everything with the parents. I talk about what types of cups they're drinking out of, whether it's a straw cup or an open cup or a bottle or a sippy cup. There's so many little ways that we can help parents set their kids off onto the right foot for the rest of their life, to be disease-free and grow well and have healthy habits. So that's all I have for you guys. You can ask questions if you want. You can reach out to me on Instagram as Dr. Baby Teeth. You can email me, or you can take questions now if you want. Whatever works for you guys.
Yeah, so I have some questions prepared, and then I'll also be checking the live chat if anyone else has any questions, and I'll ask those as well. So my first question is about the Global Dental Brigades program you did. What was your greatest experience or lesson learned from doing that?
I think it like whet my appetite for outreach, actually, which was probably the best part about it. It made me realize how much I loved it and how awesome it is to get to travel and to help people who really, really need the help, even if you're helping in some small way, like walking patients back and forth to the chair. It's still part of the team. And you also get to like see another culture, another country, and travel and like see the world as a part of it. So I think doing that in college made me like really excited about that in dental school, and it kind of helped me realize that NYU was the right fit for me because they had such a big outreach department and cared so much about that.
Did you see a difference in like the dental field in the different countries you went to compared to the US?
Yeah, I mean, so every country's different, but you know, it's not that there's no dental care in the country, it's that like different parts of the countries have different access to care. So like, yeah, there's dental schools in places like in some of the places that I visited, but not all the people in those countries have the ability to like even travel to go to the dentist because they live in like such remote villages, and they can't access it. So the dentistry itself is not so different. It's just the access to it that's a really big deal.
Okay, another question I have is, what is something you learned while shadowing?
I'd say the biggest thing that I learned about shadowing is bedside manner. The dentist that I shadowed has amazing bedside manner. She still treats like my whole family. I mean, well, actually, sometimes people will come into the city to see me in New York, but my family's based in New Jersey, and most of us still go there. And she just has amazing. She has an amazing way with her patients, like the way she puts her hands on their, arm or leg to like comfort them when they're in pain, and the questions she asks, and how personable she is. Like when you're in college, like you don't really know the difference between whether the dentist is doing a filling or a crown, or if they're doing a one procedure or another. What you should be picking up on is like the flow of the office and how the dentist talks to the patient. I think dentistry, it's so important to have good bedside manner.
Yeah, I feel like dentistry is definitely a people person, like interaction career.
Yeah, we talk a
So,
lot.
yeah.
We have a captive audience.
We have a question in the chat from Chelsea Rodriguez, and it says, "Hi, I have a quick question. I am currently in my sophomore year of my undergrad, and I wanted to start doing my shadowing. How do I go about doing that in pediatric dentistry?"
So I like I said, I didn't shadow a pediatric dentist. I shadowed a general dentist just because I thought she was such a great person. And I thought that was super helpful. I didn't feel like I needed to shadow a pediatric dentist at that point. I did spend a day or two with a pediatric dentist, but I spent the bulk of my hours with that dentist I knew from growing up. I think it's more important to spend time with someone who you like as a person and who you think is like nice to their patients versus like trying to find a pediatric dentist. But the best way I would do that is talk to your dentist who you saw growing up, whether they're a pediatric dentist or not. And if you do want to spend time with a pediatric dentist, I would just Google whoever is in your zip code and give them a call and tell them you're applying to dental school and that you want to come shadow.
Yeah, also based on my experience, I've been told for undergrad it's good to go to general dentist as well.
Yeah, it is. Like I said, no one wants you to admit that you want to specialize. So
Yeah.
it's like a funny thing about dental school. I don't know why. I guess they just want you to be open-minded.
Yeah. Okay, so another question is, do you have any advice for dental school interviews?
Yeah. Dental school interviews, I think be present the whole time. Like, don't be looking to leave early. If there's ever a moment where they're like, okay, you can go, don't be the first one to get up and go. Try and be engaged with the dental students, even though like it seems like they might not have any say in anything. You should still be really engaging, even when you're like downtime, like, not like one-on-one with a faculty member. And then during the interview, I would try and like highlight everything you can about yourself. Like that's your moment to really shine and make them get to know you. So I wouldn't hold back. Like don't be quiet about like any of your accomplishments or why you think you're a good fit for that school. Yeah.
Thank you. We also have a question from Kayla Williams. She says, "What do you value in someone who shadows you?"
I like somebody to be interested and want to be helpful. So like, whenever I was shadowing, even back when I was in college shadowing my hometown dentist, I would tell the assistant, like, teach me how to break down a room. Like, let me help you. Let me be useful. Like, you're there to shadow, but like, you might as well pitch in, and I think that's a really good way to get people to like you also, is to be helpful. And so I like when people show interest and take initiative and want to be a part of the team, even if they're there only to shadow.
Thank you. Okay, so another question is, how and like what resources did you use to prepare for the DAT?
It's a long time ago. Oh God, there's some guy, the Origo Man or something.
Yeah, I think so, yeah.
He's still around.
Yes.
His books were great. And then you can buy the books. I don't even remember. It's been a really long time since I studied for the DAT. And I probably blocked it all out of my memory. But I think he's called the Orgo Man. So he was really helpful with I want to say Orgo obviously, but then math, I think, because the math section is all about time and like doing the problems quickly. And his practice questions were pretty good. And then I use like a Kaplan test prep book, to like study. And then practice tests. I think I did an online course through Kaplan too.
It's funny, same as your last name.
Oh yeah. It wasn't my last name at the time.
Yeah. Okay, so we have another question from Noah Murray, and it says, "Do you think 4 years gives prospective dentists enough clinical experience for the job, or would you recommend something like an AGD or GPR residency?"
I would definitely recommend a GPR. 100%. It's actually required in New York State to be a practicing dentist. You have to do a GPR. I don't think 4 years is enough.
Can you explain more, like what a GPR residency?
Yeah. So sorry. That's why I try and remind myself you guys are in college. A GPR is called a general practice residency. So it's a 1-year program. AEGD is very similar. I don't remember what it stands for. Advanced Education Generalist Dent. I don't know. I'm going to butcher it. So don't quote me. It's very similar to a GPR though, but I think it's what it is just at like a dental school, not at a hospital. GPRs are usually at hospitals. And you work out of their clinic as a general dentist, treating patients in the hospital. So like the same way in the residency program, like most pediatric programs are hospital based. Mine happened to be hospital and dental school based. But GPRs are out of a hospital, so it's a little busier than a dental school, the hospital clinics. They take like similar insurance, so it's a similar patient population as the dental school, but it's just a little faster pace, and you just learn more and you get more, another year of experience just doing clinical work in a GPR. There's no like didactics or anything. You just show up, treat your patients, and go home.
Thank you.
And also, sorry, I will also add that there are some residency programs that will require a GPR first, or a lot of people will do a GPR and then apply to residency programs to make themselves more competitive. For example, like, I want to say, I don't know. There's a couple of programs in New York City, and elsewhere throughout the country that require GPR for pediatrics, and then a lot of programs that are just like notorious for only wanting people who did a GPR first. And yeah, it just makes you more competitive. Like if you feel like you're lacking somewhere, like in your grades or your whatever test scores or this or that, or like, you know, doing a GPR usually gives you just more time to like get experienced and, you know, get better letters of recommendation or like whatever else it is, makes it a little more competitive usually.
I didn't know about that residency, so it's more than 6 years, basically, right?
It could be, yeah. Yeah.
Okay, I also noticed in your outreach pictures, a lot of them were with kids, and you said that they let you go into the pediatric part of that. Do you know if in dental school they have like outreach programs for specialties?
Yeah, so that's a good question. So when I was on my outreach programs, in the Global Dental Brigades, there was a kids clinic and adult clinic, and that was it. And then at NYU, they bring a full team. So they bring, not every dental school is like this, but there are other dental schools that have similar programs, but NYU just is a really notorious school for outreach. So they bring a whole team of endodontists, so like residents and faculty. They bring oral surgery, they bring general dentistry, and they bring pediatrics. So we're not doing orthodontics on outreaches because you just can't with like all the follow-up and everything. It'd be pretty much impossible to do. And we don't bring pros because like no one's doing like implants and stuff on outreaches. It's usually like emergency care. Like people walk in with like a whole mouth needing work, and actually, you know what? I lied. One outreach trip we brought prosthodontics, and they were doing like 1-day dentures basically, which was really cool for a lot of people. They were having full mouth extractions and going home with dentures the same day. But they weren't bringing any like dental students or residents into that part. It was just this one prosthodontist who was doing it all himself because it's very hard to do that. But yes, it's mostly oral surgery, pediatrics, and endo for the outreaches, and then general dentistry.
Thank you. Okay. So also, you've done a lot in dental school and then also outside with the 2 part-time jobs. So do you have any advice for time management? You're like, we just get it done.
Just prioritize. You have to just prioritize what's important. Make to-do lists, make a calendar, spreadsheet, organize yourself in whatever way that works for you. Like if you're somebody who likes it all in your like computer organized, you like a pen and paper calendar, find what works for you. Everybody's different. Make lists, make checklists. I always liked making really colorful checklists with different colors and, spending a lot of time making them look pretty, which is like so not necessary, but just prioritize. I know it's a really short answer and it's all overwhelming when I'm in your shoes, so I'm sorry I don't have any magical advice. But
kind of a broad question. Okay, so in pediatric dentistry especially, there's like a stigma with being fearful of going to a dentist. And I know you explained a little bit about this, like making it kid friendly and showing them what you're using, but could you talk a little bit more about how you help the kids not feel as anxious?
Yeah, so we have a super fun office. We have TVs on the ceiling, which helps a lot, and access to like Netflix, iTunes, all the videos, whatever they can want to watch. So at a certain age, kids are just going to be scared. There's nothing we can do about it. Like I always tell parents, it's normal to cry. I'm a stranger. I'm putting my hands in their child's mouth. Like they're going to scream. But usually they leave happy because we give them toys and balloons and goodie bags and like lots of positive rewards, good association. So that way when they come back, they remember us. Like every single one of my patients, always asks about the treasure chest at the end. They know about my treasure chest. We have the best treasure chest in all of New York City, I'm convinced. So just on like a basic level, any positive reward, and association you can do to make them want to come back is great. And like to leave on a high note is always great. And then for the kids who like are a little older and like genuinely are scared, we do a lot of, I was saying like tell, show, do. So like you tell them what you're going to do, you show it to them, and then you do it. That's like one of the biggest principles of pediatric dentistry is tell, show, do. So in terms of behavior management. So we, we'll show them the Profi angle, which is like the electric toothbrush, for example, and we'll say like, okay, we're gonna brush your teeth like it's an electric toothbrush. We put it on their finger, like let the rubber wheel spin on their finger, so that way they can literally feel what it feels like on their finger, and then we do it. Or we do it on like a puppet, like I think I had a picture of me holding one of our little dinosaur puppets. We show them how we are going to count the puppet's teeth. We count the puppet's teeth together with our instruments, with the mirror and the explorer, and then they get to hold the instruments themselves and feel them and touch them. Sometimes I'll even give the kids like a handheld mirror, like a big one, and then that way they can watch me doing whatever I'm doing in their mouth. So that way that takes away like fear of the unknown. And we always ask it, they let them ask us questions and like touch everything, feel everything. Sometimes like letting an older sibling go first is really good to model, or the parent will put whatever it is in their mouth first to show the kid it's okay. We try and make them as comfortable as possible.
Those are some great methods, and yeah, it all has to do on the psychology of it. Also, you said you work with special needs patients, so how is it working with them?
So the most important thing is just giving individualized care. I enjoy it. It's part of being a pediatric dentist. Every kid is different anyway, but every kid with special needs is different, and so what works for one might not work for another. And I think what you learn to do as a pediatric dentist is you just have to think on your feet and remain calm, and be reasonable with the parents and meet expectations. And I think that whenever you're open and honest with the parents about what they're expecting out of the visit, they're going to be like your biggest advocate and your biggest helper in making sure that things go well, and like get the kid prepped for every time they come in and help talk to them about what to expect ahead of time. Parents can be a huge, huge help in so many scenarios, if you can get them on board with what you need out of them. But yeah, every kid with special needs is different, and we try and give them individualized care, whether that's like doing desensitization visits and them coming in more frequently instead of like once every 6 months, to get them really comfortable with just walking through the door. Like I have patients that literally won't even get out of their car to walk into our front door. So like baby steps,
Thank you. Okay, so now going back to dental school, I don't know if you remember, but what is your favorite and least favorite class from dental school?
I probably blocked it all out. Oh man. Every year is so different. I don't even know if I could pick like a favorite and a least favorite over the 4 years, because every year changes so much. Like the first year, it's like so heavy science classes, and then second year, you're like more into lab, but it's still a lot of like dentistry type classes, but less hard. Like probably my least favorite was one of the basic sciences. I don't even remember which one, like organ systems or something. I don't know. I didn't love the basic science classes. And then, third year, fourth year, you're like mostly clinical, depending on what school, like depending on the time you start clinic. But clinic is tough too. It's not like easier in any sense. I don't know what my most favorite class would be.
It's okay. If not, maybe like a piece of advice for going through dental school.
Sure. Just stay focused. It's a lot. Dental school is really hard. It was the hardest 4 years of my life. Like it's no joke, dental school. And everybody around you is really smart. Like I felt like in college, everybody around me was really smart, but in dental school, everyone's even smarter. Um, and try and just make as many friends as you can because like you get through it together in dental school. Like you study together, you share your notes, like you help each other in lab. Like you're having trouble doing one thing with a prep, and a classmate will help you out, and vice versa. So, and whatever you're good at, someone else won't be good at, and you'll help each other. So having friends is really important. And you make friends along the way anyway, because you're like all suffering together, and misery loves company. So everybody bands together in that sense.
Thank you. Okay. So another question is about your research from your D0 period. So what was that research about?
So we were working on it was designing an effective home intervention in the population that we were working with in Poughkeepsie. So kind of like, oh man, I don't know how to describe it. It's been so long. Analyzing, like, it was more like psychology based in a way, like analyzing motivational interviewers that were going through questionnaires and figuring out what worked and what didn't, and actually decreasing caries rates.
That's interesting. So another question is, what is the application process like for residency?
It's very confusing. That's another thing that having friends is really helpful for. I remember there were 2 or 3 of us that kind of got together and made a whole spreadsheet of what each program wanted and like what the requirements were and what the deadlines, because every program is totally different in terms of what they want, when they want it by. And just getting that organized was half the battle. And there's no like standardized website that you go to where like every program is listed on it with like all the requirements. Like you sometimes have to like dig very deep on like a hospital website to find their residency page, and like then you have to call and ask, and it's like a whole thing. So dividing and conquering was really helpful. And then in terms of like the physical, it's not hard. All the work is done before the application, honestly. Like like all of your having done research and your grades, like if you have to take, some specialty programs now require more tests. I forget what it's even like. Now there's the ADAT also, like whatever test you need to take. So all that work is done ahead of time. Your letters of rec, all that.
Thank you. I was just curious if it was the same as dental school, but it sounds difficult as well.
I don't remember. I don't remember dental school applications, but I think it was more organized, isn't it? Like it's like one application. Yeah. So it was a lot harder than that, in that sense. That there's like one standardized application that you then just like click whatever box you want to apply to for schools, and then if you have a supplement, right? That was dental school. Yeah, residency was like so all over the place.
Okay, so we have one more question for today. What is your favorite thing about being a pediatric dentist?
So I talked about that at the end. I love first visits. I love when parents bring in their kids when they're 1, and we can talk about well. There's like just so much that we can influence when they're that young. So it's great. That's my favorite part, is the first visits.
Thank you. I wanted to thank you so much for your time, for taking time off your busy schedule. And thank you, everyone watching, for your questions.